It's Jim Hennager. It's December 27th. Kind of a cold, blustery day, but the lake still hasn't frozen over, so we're still continuing our unusual weather. Getting a drip right here into a bucket. Wearing my new Christmas sweater. I usually get one every Christmas. And when you're as old as I am, you end up with a lot of sweaters, nice sweaters. I enjoy them, I appreciate them. One I was wearing the other day was probably 30 years old, so just to give you an idea. Today I want to get into some subjects again in the area of solutions. I have the feeling that these are tougher areas to get into, although the others have been more imaginative. These have what you might call more skin to them and hit closer to home, so that people probably have more of an acute idea about the future of these. But my overall principle here is that I don't think the federal government should be in the welfare business. I don't believe it should be in the Social Security retirement field. I don't think it should be in the medical field. And as a result of these incursions into these areas, what we've done is put our government at risk. I believe within the next 10 years it's very possible that Social Security disability, Medicare, Medicaid, the Affordable Health Care Act will come to 50% of the federal budget. And we already know that the interest on our debt is closing in on 30%, and our military has been 20%. There isn't enough percents there to go around. So, I've advocated that the cost of the military and intelligence come down into the 5 to 10% range, and I really think that the cost of these welfare programs need to come down as well. Now, I'm not opposed to helping people that need it. There's been times when I've needed it and it's helped out. I was laid off in 2008 along with 10 million other people. It was a huge shock. Never saw it coming. To this day, I don't believe the company needed to lay those people off, me included, but they did, and there was obviously reasons for it. But what's happened is that the Democratic Party, I'll just be upfront about it, the Democratic Party is using the votes from the people that benefit from these programs to get elected. And we've seen that since '92, and I think it's going to be a big important issue in the 2016 election. So over and over again I try to explain how Congress works when you look at it from the outside, and that is that politicians wanting to get reelected go to special interest groups and they create a pact with them so that if they give them money, they'll sponsor, they'll push, they'll support their legislation. And this certainly is the case in the Affordable Health Care Act. And as soon as I saw it being put together, I could see that it was going to end up a mess and very, very costly. Because on the one hand, you had the politicians saying that we need this program. We have 44 million people that aren't insured, and we need to protect these people. We need to do something to help them out. And so, the Affordable Health Care got passed, and now we're stuck with it in a way. We'll see what happens in 2016, but when you look at it underneath, it wasn't put together to help those people that weren't insured before. It was to help those people that were getting basically burned by the people that weren't insured. Let me explain that. In 2004, 2005, 2006, we had gotten up to the point of having almost 2 million people a year take out bankruptcy, up from 1 million and 1,200,000 in the years before. So those 2 million people taking bankrupts had an average indebtedness of $30,000 or about that, and of that 30,000, about 70% of it was medical cost. Surgeries that they couldn't pay for, or hospital visits that they couldn't pay for. It accumulated up, and so they took bankruptcy to get out from under it. Well, you take 2 million times, say, 20,000 each, and you're up into the $40 billion range. That's what these medical providers, the hospitals, the doctors, the specialists, and the insurance companies were basically losing through this bankruptcy route that people who didn't have insurance were taking. In other words, they had insurance. The insurance was bankruptcy, okay? So the answer to that problem for the medical providers was to give a lot of money, first to Hillary Clinton, and then as she bowed out, it moved to Obama, and probably in the tune of 40 to 50 million was given to the Obama administration and to a host, both Republicans and Democrats on both the House and the Senate, to get it to pass when it did. So I hope you understand that it wasn't really, meant to help out, some poor person that didn't have money for insurance. It was to help out some super rich corporations that didn't want to lose more money. Okay, now we have sort of the principle that hospitals in the United States should be there to benefit, people, and they should have some reserve to help take care of those people that don't have insurance. And many states have the law that if you come to an emergency center, most hospitals basically will take care of you, even if you don't have any money. Now, not all hospitals will do that, but I hope you can see then that the way this was put together was to protect those people that were losing $40 billion a year, and the way to do that is to require everybody to have insurance, health insurance, and that's the key element of this whole legislative piece. And it was a major increase in taxes. I think the Supreme Court has ruled that this is a tax. It's not really a social program. It's intended to gather money from everybody and dole it out to the people that need it. In this case, the hospital providers, the doctors, the insurance companies, and the pharmaceutical companies. The money is not going to individuals. The money is going to these providers. Okay, and those are the people that supported it. But in that, what this Obamacare, as it's become called, does is continue a tradition of health care that's westernized, Americanized, and it's basically supporting the for-profit kind of medical services that we have here in this country. Most countries have moved to some other kind of health care that's either strictly socialized or much more competitive than ours. What we're finding in our medical system is that the whole system is designed so that the medical providers, the insurance companies, pharmaceutical companies can make the most money. And all you have to do is look at the increase, the inflationary rate on those services and practices, and you can see that it's been going up 14-15% every year or more. Okay, so the whole system is designed as a profit center, a way to make money for these people that go to school, and so they come back and they've been to school for 12 years or whatever it is, and they say, look, I've gone to school for this long, I deserve to make $270,000, and I deserve to live in an $800,000 home, right? Well, bullwinkle, I don't believe that at all. I know in the Philippines, where my wife is from, You can get a tooth pulled for $10. You can go to a doctor for a couple dollars. You can go to a hospital for maybe $10 a day. So it has nothing to do with services to the people that need it. It has to do with getting payment that they want to the people that want it. Okay, so that's a very controversial statement, but I believe if you look into it, you'll see that, the doctor's office cost used to be $10, and then it was $30, and then it was $60, and then it was $90, and now I don't know if you can find a doctor's office that'll take you for less than $100. You either have to have the insurance card or the Medicare card, or $100 to pay them up front. Okay, well, what's increased is their salary, their income, not their cost. Now the cost of medicine has gone up as well. In fact, sometimes we're seeing pills cost $3,000 a piece. In the cancer area particularly, these people have been raking it in hand over foot. And you have to wonder whether they're providing the best service to everybody or if they're just adding up the dollars so they can put an extension on their house or go to Europe for a vacation. You have to wonder about that, okay? So when we look at it in that sense, there are ways that you could put together a program to benefit almost everybody, and it isn't free, but it's almost free, okay? And I'm going to move in that direction because I'm an advocate of providing health care for people. I think that's just a social responsibility. I just don't think the federal government should do it. I think that's an area where the federal government should stay out of. Now, they could provide guidelines, they could provide standards, they can provide grants and help doing research, but to get into actually providing the services and paying for them, and I don't agree with that. I see the federal government sort of like a board of directors of a large organization. They need to set the standards, they need to set policy, but they shouldn't be involved in everyday kinds of operations. That's just a call for abuse, and that's what we're getting at. I've read that the Medicare program alone has over $34 billion in waste and fraud. And that's what's happened when you have a huge program and you have, very few people watching the dollars go through it. You get that kind of an opportunity. I think that's what's happening with healthcare today. Some of these health providers are making more and more money at the expense of the rest of us. Now, I'll get into some strategies that I think we could move to change that around. The health providers aren't going to like them. But I think they need competition, to be honest. There's no downward pressure on the price of medical services today. It's always up, okay? And the only way you're going to have those services go down in price is to have alternatives to it, options, downward price, okay? Some more competition, which they're not getting, okay? So that's one of the answers. I think we also are seeing, and that's why this one is following the one on agriculture, where agriculture, I at least see it, has gone from working on the land in a natural way to almost completely a chemical strategy, using more and more chemicals, which the chemical companies love, the farmers love, but as I told you in the other video, I think it's costing the consumer an awful lot. I think the same thing is happening in medicine. Instead of looking at it in ways to keep people well, to prevent illness, what we're doing is encouraging people to be unwell and get medical services that cost a lot. And I think that's the wrong approach. I think we need to move towards a very educated wellness prevention kind of strategy in our healthcare, and I have some skin in this. I've been involved with health insurance for public schools and offering incentives to people to stay well, and it works, okay? So let me kind of explain how I got into this. It was in the 1980s. I was working for a state education agency that represented the schools in that area, And what was happening was their cost of insurance, health insurance, was going up 20, 25, 30, 35% every year. It was getting so bad towards the end of the 80s there, with some schools getting 35% increases every year, that they were after laying off teachers just to pay for that benefit. And I think it's a very complicated issue because it's not just one factor in here that's increasing the cost to it, and it's not just the insurance company's cost making the cost go up. It's a combination of things that are causing the total to go up. And so I need to kind of walk through that a little bit so that we're on the same page. I was able to organize over 100 schools, public schools, into an association where we basically bid out the insurance, which brought competition into it. They didn't have that competition before. We ended up going all the way to London and worked with Lloyd's of London on a package, and we were able to bring in rates where there were no increases at all. And so these schools that were getting 35% increases were very interested in looking at the options, and we were able to provide that. Now, the big two companies in Iowa that were providing most of, 90% of the health insurance, they were very upset that there was somebody coming in and offering, an alternative to that. And I won't get into the details, but I can tell you the insurance business is not a nice business. It's dirty as you can get, and I certainly can vouch for that. They want to keep their monopoly on the insurance industry. But what I saw when I started gathering medical histories in places, I remember a teacher in northwest Iowa that went to the doctor 55 times in a year. And my thought was, wow, they have to be really sick, or there was something else going on. And what it turned out was that the school had developed a policy that teachers and staff could take a half a day off if they had to go to the doctor. Well, that was an invitation for this teacher to set up appointments every Friday afternoon. She'd set up an appointment at a different doctor or dentist, and it was this kid or that kid or herself or her husband or somebody was always going to the doctor, but it was an afternoon off, and everybody knew that she just went shopping after stopping at the doctor's. So we see abuse, and that abuse comes from how people have looked at insurance, health insurance. If you go back to the 70s, when my first contract to teach at a college, it included health insurance, but I had to provide, maybe $60 or $70 a month on a package that had a $500 deductible. As the years went by, my side of it had to go up, and the deductible came down. What we were seeing were teachers' unions, basically, getting into not being able to raise the salary levels of employees, so they went after the benefits, and the health insurance was I suppose, an easy target, because when it started out at $500 or $600 deductible, and it came down to $300 and $200 and $100, and then it came down to first dollar coverage. In other words, there was no deductible, there was no skin from the employee's side. They just walked into the office and everything was paid for. Well, that changed the attitude towards healthcare as well, because now the consumer, the person that had the insurance, was thinking, hey, this is my benefit. If I don't use it, I lose it. You follow? And that's what they did. They used it and used it and used it. And that drove up the cost. So if you were the insurance company and you saw this happening, you'd have to raise that premium to cover those rising costs. And much of it was from abuse. It wasn't necessarily that everybody had, absolute medical cost. It was that they were getting, more and more services and billing it to the insurance company. Okay, so that was one factor. The insurance companies developed a practice. In one case here in Iowa, one was getting like 28% administrative charges on their group plan. Well, that's an awful lot, and so if your claims were going up, say 30%, and your people were now paying $600 or $700 a month on a first dollar coverage, and the claims went up, they've raised the premium, guess who made more money? The insurance company. If you were paying $100,000 one year and next year you were paying $150,000 and the insurance company was getting 28% of that, guess who came out of it pretty well off, okay? So as long as that was happening, the insurance companies were willing to keep moving up the price until we got to, this is a price elasticity issue. You get to a point where people can't afford it anymore. And I think that's basically what was happening. And more companies, small companies, dropped in health insurance. They just couldn't afford the premiums. In some cases, by the 90s, individual health insurance was costing $1,000, $1,100, $1,200. Farmers out on their own farm were having to pay $1,200 a month for health insurance, and many of them just stopped buying it. Okay, so it wasn't just poor people that didn't have any money that were not insured. It was a lot of people in the middle class who just made that decision that we can't put $600 or $800 or $1,000 a month into health insurance. We're going to have to take the risk ourselves, which is really what you're doing. So what we got is a very fuzzy idea of what was happening in the medical world. So the one side was saying, hey, we got 40, 50 million people that aren't insured. They're in desperate need of medical attention, but they were getting medical attention. The people at the bottom of the economic scale were typically going to emergency rooms and, forcing medical services on themselves and not paying for it. And then, if it built up over the years, they would go and take bankruptcy. So in a way, we had a medical system that was working for the poor, but it wasn't working for the medical providers. I hope you understand that. So a lot of it was abuse and misconception about insurance being there to protect you in case, of an emergency. But, people started going to medical clinics and to emergency centers for sore throats or a small temperature. And that also got back to some policies. We represented a hospital up in north central Iowa. They had the policy that their own nurses could get free care if they would come to their own emergency center on the weekend. I remember one February where 100 nurses billed up $35,000 in emergency room charges for the flu. Okay, they could have waited till Monday and paid the $10 copay and 80/20, but they came in on the weekends or any day to the emergency center to get it paid in full. Well, the hospital didn't mind because that was $35,000 extra that they were getting billed to the insurance company. The insurance company turned around and says, well, if you're going to do that, we're going to have to raise the rate, and they were one of those that got 35% increases. So, it's the old balloon thing. You press the balloon on one end to save some money, and you're going to, more than likely expand it on the other end. So a lot of it has to do with administrative policies, school policies, hospital policies, company policies, and the idea that health insurance became a gold-plated benefit rather than a risk aversion kind of strategy. And people, they stopped trying to take care of little things at home. A sore throat can be taken care of at home. A small fever can be taken care of. So we had this industry developing this idea that, at any kind of cut or rash or an itch or headache, anything, you should go to the doctor immediately. Well, you go to the doctor's office, you just opened up the opportunity for them to make money. Okay, that's how it comes out. And they can also make money by referring you to an ear specialist or a brain specialist or a cancer specialist. It just opens that door up for them to create multiple paths to bill you. Okay, I've had that experience myself. I did an annual test for Medicare and came out that my left ear wasn't as good as my right ear. I'd worked in a factory. I knew that that probably was the case, but they thought it was unusual that one ear was different than the other, so they first sent me to one hearing specialist in Des Moines and then to another hearing specialist, and then they took a CAT scan or something, on my brain, and it's still working apparently. But I think the total cost of going around to these hearing specialists was like $8,000. And the end result was the second specialist cleaned out my ears. Here I had wax in my ears, $8,000 to clean out my ear. Okay, so that's how ridiculous it gets, And you just start multiplying this whole scene, and you can see where the costs are just going up artificially. Okay, now there's also some real cases, and when you start looking at what's happening to people that are really sick and they need the medical attention, a lot of times they'll delay. These are the people that probably aren't on insurance, and they don't want to take bankruptcy, and so they delay. It just makes some of these conditions worse. And so in an average way, it turns out that 80% of the claims come from 20% of the people. And of that 20% of the people, you have another 80% of them that generate another 20% of the 20% I'm talking about. So you really are down to like 5% of the people generating 50, 60, 70% of the claims. Those are the people that really need medical attention. Okay, they have the cancers, the heart disease, and so forth. Now, one of the things that I got into right from the beginning when we started putting this together with Lloyd's of London was that there has to be a behavioral element here. If people were socially, culturally changing how they looked at insurance and medical services, somehow we had to change that. And so we built into the program layers of insurance. And so your first layer was $50 a month, which became your $600 a year deductible. Okay? And the idea there was that that was your money, and it was kept in a separate fund. And at the end of the year, if you didn't go to the doctor, you didn't have any reason to go to the doctors, that $600 came back to you. Okay? That's a very simple behavioral change. And in one school district that had 21 teachers, 20 of them, 20 out of 21, got their $600 back. They had no claims. I see the behavioral incentive works, and the one claim was a very severe claim, and so their total billing was pretty high for the whole group, but there was 20 people who got $600 back. Okay, I don't see that. I don't see those kind of wellness programs. I don't see that kind of prevention. I don't see that kind of incentive. Okay, and none of that is in Obamacare. Okay, the second one went from $600 to $3,000. That's $2,400. That's $200 a month. That was set aside into a second account that was yours if you didn't use it, but you can't take it out. It rolled over to the next year, and so that $200 plus the $50 was basically coming out of your pocket and going towards that first $3,000 of claims. Then from $3,000 to $100,000 was where most of the medical claims, sizable claims, were coming, and that was then bid out. In this case, the Lloyds picked it up, and it was about $300 a month. Okay. Then we had $100,000 and above, which is catastrophic claims, and that was then bid out, and that claim, that premium, I believe, came to about $60. Okay, so you had basically 4 premiums, 4 levels. You had your $50, you had your $200, you had your $300, and you had your $60. Well, you add those up, and it came out a lot less than what the insurance companies were asking for. Okay, plus it had the incentives, and it had the ability to get into some real wellness and prevention. Okay, so I believe that that's what we need to do today. We need to develop those layers. We have different risks, but everything's covered. There's nothing in there called self-insured risk in this plan, and there wasn't for any of the schools that got into it or the hospital that got into it. But insurance companies hated it. I mean, I can remember going to some meetings with some very large schools here in Iowa, and what I was bringing to them in this strategy would have saved them $50,000 a month. Okay, but they didn't want to change, and I can remember going into a meeting in this one school, and two vice presidents of the big insurance company were there, plus a member of the labor union. They fought it tooth and nail. They did not want it. But the irony was that what they did for the school was develop an exact duplicate of what we were offering, and the school got the $50,000 a month savings, but they stayed with the same company. Now, overall, that year that almost all of these schools joined, they were expecting a 35% increase, and because of the competition, the two large insurance companies brought their increase down to 4%. Okay, so how could they do that? How can you drop from 35% down to 4% if you don't have some leverage in there? But they're obviously trying to keep the business, which they did. Of the 350 some schools in Iowa, they all benefited because all the schools' rates were dropped by that amount, and we estimated that we saved over $30 million to Iowa schools that year because of competition alone. Okay, so I don't see that happening. I don't see anywhere that there's competition. I don't see any place in there there's incentives to stay well, and that it's not going to work. Okay, but there was something else I learned as we got into this, that if you're looking at that 20% that create the 80%, and then within that 20% there's 20% in there that are creating more than half of the claims, and you can identify those 5 people out of 100, then you need to work with those people, okay? And they can be identified in a screening and interviews and blood tests and x-rays, whatever it takes. But what I found out was that these people that are at risk can be identified. It might be that their cholesterol was high, it might be that their weight was high, it might be that their lung capacity was low, it might be that their blood workup showed that they had problems in the blood workup. It typically turned out that they didn't exercise, they had trouble sleeping, they were under a lot of stress. You could identify those conditions. These people smoked. And what I also discovered, 2 things was, one company up in central Michigan that I worked with, who also had made this discovery, they identified those 5 people. It really was 20 people at the beginning that were at risk, and at the end it was down to 5. They created incentives for them. They paid them $500 or $600 to quit smoking, and they quit smoking. They paid them, so much money to join exercise groups. They put colored tape around the factory, and instead of eating candy bars and pop or coffee, they would create the incentive to go walk around the factory at breaks. They took out the pop and candy bars and put in fruit and fruit juices for free, and people started eating better, stopped getting all the sugars, and they had a weight contest. The more weight you lost, you got $10 a pound or something. People lost weight. So people that were putting themselves at risk, their own behavior, putting themselves at risk, can change that behavior. And it got to the point where in the second year already, the total premiums that they were putting into their self-funding pool paid for all of the claims in the third year. So they didn't have to increase their premiums. They didn't even have to pay premiums the third year. Are you following me? They saved that much money by identifying the people at risk and working with them individually. That requires that everybody mandatorily has to be involved. You can't have 2 or 3 people that don't want to step on a scale or they don't want to exercise. Everybody has to go along with this, but it can be reduced. I don't see any of that in Obamacare. I'm sorry, okay? So the last thing that I discovered was that we weren't the first ones to discover this. In fact, one of the major insurance companies in the nation had done research in several states, which included Iowa. And they'd come to the same conclusion, that they could reduce the premiums by reducing the claims through these incentive programs, identifying high-risk individuals and working with them. But they didn't want to. Why? Because that meant less money. The less claims that came in, the pressure would be down for lower and lower premiums, and the lower and lower premiums meant they would get less money. So they deliberately did not do it. Okay? Boy, that just burned my hide. I just couldn't believe that. And I think if the healthcare program that we're advocating as a nation, I think that we could develop programs where we identified people at risk, we worked with them, we reduced them, and we could change the attitude towards healthcare. There's countries where you only pay the doctors as long as you're well. When you're sick, you don't pay them. I think in Western China for many years that was the norm. Now, I don't know that we're going to do that, but I think we have a screwed up system here. The doctors only make money when they can keep people sick. Hospitals only make money when they can have people with claims. Pharmaceutical companies only make money when they can sell drugs. Okay, that's sick. I think we got to get away from this system, and I think we can do that. I think we can get people healthier. I think we can prevent major illnesses. You're always going to have things happen because cancer is not very predictable yet. But someday I think we're going to find cures for cancer and heart disease. And the medical profession is really a dying dinosaur, in my opinion. I'm hoping in 50 years that everybody can stay in 95% of the people can stay in very good health, have 10 years before they go to see a doctor. I've gone 10 years without seeing a doctor. I'm not in any kind of prescription medicine, and outside of the sweaters fitting a little tighter each year, I'm doing okay. I'm 67. On the other hand, what we're seeing is that the average 65-year-old in the United States is on 10 prescription drugs from 3 different doctors, and your chances of dying from a drug overdose or an interaction from these drugs is higher than all of the deaths from illegal drugs combined. You're 4 times more likely to die from these drugs that you're taking by prescription after you're 65 than you are, it's the 3rd cause of death. There's heart disease, there's cancer, and then there's drug interaction, okay? You don't hear a lot about that because the people that make money off those drugs don't want you to hear about it, okay? But it's a very dangerous situation. The drugs that are, being prescribed are highly volatile in your body, okay? So, I see some ways that we can move. I think there's some ways that we could set up health centers, hospitals that are really nonprofit and want to benefit people instead of paying their doctors. I don't know if you realize this, but if you go to medical school today, you're maybe going to take 1 class in nutrition. Up until 10 years ago, you probably wouldn't have taken any classes in nutrition to be a doctor, okay? All you did was understand the symptoms and figure out what kind of prescription medicine to give them, okay? Now, there's some really, bad things going on in that realm because doctors who prescribe certain medicines get rewarded. They get vacations. They don't call them vacations. They call them continuing education opportunities, but it's at an 18-hole golf course in Florida or Texas or California or Phoenix or some cases Hong Kong, okay? They're required to go there and they get a CEU credit for coming, but they might only spend 20 minutes, but the rest of the time is on the golf course or on the beach or something like that. But they only reward those people that might have 3,000 prescriptions or something like that. That's cronyism. That's bribery. And I don't think in medicine we should allow it at all. Okay. I also found that happened in the insurance business. There were superintendents who got free vacations over winter, like December to January, from the insurance companies on the low T. They were offering them incentives to stay with them. And the superintendents were, I knew 2 superintendents that were doing that. I think that should be illegal. Okay, so we gotta tighten this up so that we don't have the abuse, we don't have the bribery, we don't have these bad practices, And we really can identify some of the worst risk and work with them. This one company in Michigan identified 5 people, and they had nurses work with them, doctors work with them, and after a couple of years, there was only one of them that had any claims at all. So some of those kinds of ideas should be implemented. I think if we developed a program that had those in it, we could actually lower the claims, we could lower the risk, and we'd have people healthier. Now that gets into another area, which is the most controversial. I'm going to get into this area, and you could do backflips on this one. Some of my students certainly have. But if you go back to some of my other videos, I'm suggesting that I don't believe we evolved. I don't think this body is one that grew out of millions and millions of years of evolution. I think our bodies were designed, and they were probably designed by a level 8 intelligence out there that had teams of what I would call master biochemical cellular experts, DNA experts. We can do some things with artificial insemination, and we can do some things with in vitro kinds of things, and we can clone some things, but we're not at that level where we can actually build a DNA, RNA, part of the cell and get it to duplicate out so that you get an elephant here and a mouse here just from the same cells. But I'm sure that there's civilizations that are at that level, and those geneticists, those DNA experts, probably created models for different planets, and maybe thousands and thousands of different human-like models. You have to appreciate that we're not looking at the Earth as being the center of the universe anymore. We're looking at a universe that has hundreds and hundreds of billions of planets that have the potential for life, and some of them are millions of years older than us. You just have to come to the realization that there's civilizations far more advanced than us, and because our planets, all planets, go up and down, we have ice ages, we have plagues, we have natural catastrophes, we have wars. As planets go down, there's another more advanced civilization that is a caretaker, and they're protecting us in a way, and they're caretakers. So if we go down, they're probably going to bring in, remnants of people coming from other planets, which I think has happened here on Earth a number of times in the last 20,000 years. I think there's probably been at least 2 arrivals, if you wanted to call them that, by the mothership or the DNA specialist or whatever you want to call it. But when you start looking at it this perspective, and you're thinking about, and this is hard for us to appreciate because we can't step into their shoes, but let's say you're this DNA genetic specialist, a whole team of you. Why would you build, design, develop a human body that couldn't take care of itself under most circumstances? Do you follow me? Why would you build a model that's going to get cancer, is going to get brain tumors, is going to get heart disease, is going to have to have all kinds of medicine to stay healthy? You wouldn't. You're going to build a model that for the most part can take care of itself. And I think that body can do that if we do some things. It's not just a freebie kind of thing here. We have lost common sense in how to take care of our own body. See, I think there's some parameters for each person is a little different, but there's certain parameters that each body has to experience to stay well, and we're not doing them. Okay. For example, I think the human body needs a certain amount of sleep. I know people that are trying to get by, students are trying to get by on 2 or 3 hours of sleep a night. That doesn't work, okay? I think there's certain nutrition that you need, okay? I think there's certain water requirements you need. 70-80% of our body is water. The cells need water to transport the food in, the oxygen in, the water into each cell. And if we don't have enough water, that's a problem. I think we have a lot of people that are dehydrated and they're not drinking enough water. In the last 20 years, we've seen particularly children start drinking pop instead of water. You can't get them to drink water. And that's bad. And that's one of the conditions I think your body needs is enough water, enough sleep, enough exercise. Your body organs need exercise to function, to get them in and out kind of transference in the cells. You need that exercise. And I think you need to avoid stress. I mean, stress really can kill you, okay? So you need to set up some parameters of those things that we do to take care of ourselves. And we're not doing them, We're eating so much sugar these days, and the calories that we're eating and the amount of food that we're eating that, on average people are gaining 1 or 2 pounds every year. I have to, so I'm not, the best example of this, but I try to get sleep, I try to drink a lot of water, I try to eat nutritional food, but a lot of people don't, okay? And, you get to a point where you're in a doctor's office and you're having this pain in some part of your body and they look into it and you got cancer. And it's not your fault. We don't know what causes it. It's sad that you've got it, but you're in good hands because we know how to take care of it. We got chemotherapy, we got radiation, we got all kinds of drugs that we can give you to get rid of it. Hopefully. The 5-year probability, is such and such. Okay? You see how the game has worked? In fact, it would appear that the cancer people don't want to cure cancer at all. They just want that income to keep coming in. The heart specialists don't really want, to have you be heart healthy because then their income goes down. We already know that 30-40% of all of the angioplastic kinds of surgeries and the open heart surgeries are not needed. You get the same results by going to a healthy lifestyle. Okay, we know that diabetes can be cured by 2 years of healthy lifestyle. We're almost to the point where the medical community has put on the consumer, the average person, this idea that the only people that are healthy are those people that are on drugs. That's ludicrous, The only people that are really healthy are those that don't have to have any drugs. Okay? So we've gotten this whole thing screwed up. We see that, the pharmaceutical companies will come out with a new drug with a fancy name and they'll spend, 40, 50, $100 million in advertising and they get results. I've seen an ad for a new drug and they won't even tell you what it's for. They just say, go to your doctor and find out what this is for. You need it. That's crazy. And we know that it works. The more that they push the advertising, the more people go to the doctor and ask for that drug. That's backwards, In fact, I think there's only 2 countries in the world that even allow advertising of this level for prescription drugs. We've outlawed it for alcohol, we've outlawed it for cigarettes. We need to outlaw advertising for pharmaceutical drugs in the United States. I think the United States and New Zealand are the only 2 countries that allow this kind of advertising. Doctors should have the knowledge to make prescriptions without pushing it over the TV or the magazines or radio. And if you look at the 5:30 news at night, a third to a half of their advertising is being billed to pharmaceutical companies. So you get this mainstream pushing these drugs, and when you hear all of the side effects, they can include a whole list of very serious kinds of problems, all the way up to, this may cause suicide. Well, why would you take a drug that's going to cause suicide if you had some options? And staying healthy would certainly be an option. I saw this in my students the last few years. I've had at least a half a dozen students that were absent from class, and then I find out that they were in the hospital. And in each case, they fainted at work. Okay, So the parents got very excited. They were worried about brain tumors. They were worried about, some kind of disease. And after all the results on every one of these cases, it turns out that they weren't drinking enough water. They weren't eating the right kinds of foods. In fact, this one female student was only drinking, a certain kind of yellow pop, and she was only eating potato chips. And she was working, 2 part-time jobs and going to school. She was getting very little sleep. She just dead away fainted at work. And when they finally got her back on a regimen of drinking water and eating healthy foods, she came out of it. Another student that I had came back a couple years after the class, and she told me that she really wanted to thank me because she had gone through this roller coaster. I call it the Great American Roller Coaster ride. She'd gotten married early and she got divorced early, and she'd been depressed, and she was going to a couple different psychiatrists. She was on several different kind of psychiatric medicine. She told me that she hadn't drank water in 10 years unless it was to swallow pills, and she wasn't eating or exercising, and she got so depressed that she was starting to think about suicide, until she remembered the class and my suggesting that the first thing they do to get off of that mental merry-go-round, is to start drinking water. So she started drinking water, first time in 10 years, and then she started eating healthier, she started walking and exercising, and within a couple months she was off all the medication, and she thanked me, in her words, for getting her life back. Okay, so I'm not a medical doctor. I'm not trying to, give you medical advice here, but there's just some common sense things here that we need to be doing that we're not doing. Okay, we've gotten this idea that for every little thing we go to the doctor, and the doctor, to make money, is going to give you medicine or have some other specialist involved, and it's just an escalating kind of cost to everything. I think we have to have more programs that teach health, and not just, a health class in 6th grade. I think everybody needs to get into this deep, and people are different. How much sleep you need and how much nutrition you need are different from one person to the other. There's another thing that I learned in this, and I gave my students this challenge that we had. At one time we thought that there might have been half the people in the world that went to bed hungry. It turns out that that's not really accurate, but there could have been, 200 million people that were malnutrition, and there's probably as many as 50 million kids under 5 that die from malnutrition and those related illnesses every year. That's a huge number. To me, that says that we're not taking responsibility for, the people that are here. Those people that can help should be doing more. Now, we know we have doctors and nurses and volunteers, and I applaud them, okay? But my challenge to the students was, let's find a strategies where we could, lower that number on the nutrition. And so what we got into is, well, why couldn't we, provide them vitamin pills? If vitamin pills are doing the job of providing nutrition, why couldn't we have 100% of the nutritional need in some vitamin pills, and find ways to distribute them? Well, it turned out that one of the guys in class actually was studying to be a doctor. It was connected to a company that was selling some very high-cost organic vitamins, and I think each one of those tablets was like $3 a piece, and you had to take a couple of them a day, in that program. So it was very expensive. Most people certainly couldn't afford it, but they were big tablets, and they had everything in there that you needed, basically. So we got to looking into it. We learned 2 things that I need you to understand. One was a surprise to me. This caught me. I did not see this coming. I'd always, seen the Department of Agriculture's, a pyramid where you had different levels of meat. You had your milks and your calcium and your meats and your proteins and your vegetables. You had all of those to create a diet. But it turns out that you don't need any of those. You don't need meat, you don't need milk, you don't need, fish, you don't need rice, you don't need potatoes. because your body doesn't really operate on those foods. Okay, so then the next level would be, and then where we were going with this, and it must need those vitamins and minerals that you see advertised all the time. Well, it turns out that your body doesn't need vitamins at all. In fact, vitamins are just a label given to a combination of chemicals. What your body needs are certain kinds of chemicals. Each cell, and you got trillions of cells, each cell needs certain kinds of chemicals to operate. Every one of your brain cells needs certain kind of chemicals to operate. And we're talking about magnesium and calcium and phosphorus and, those kind of chemicals. And if you take, these 3 or 4 chemicals and put them together, that's vitamin A. If you take these kind of chemicals and minerals and put them together, it's vitamin D. Are you following me? There's nothing, that vitamin B, vitamin C, all these are combination of chemicals that you put together. They're formulas, okay? We approached a vitamin company, a manufacturing company, and they didn't want to tell us this. It took me a number of phone calls before I got it out of them that they just take chemicals off the counter and follow a formula, pour them into a big pot and mix it up, and then stamp them out to get their tablets. Okay, so you need to understand that, because I think in the future it's going to become more and more expensive for everybody to eat hamburger and steak and potatoes and all of those kinds of foods. I think what we're going to do is move to, I don't like to call it artificial food, but I think it's manufactured food that involves all of those raw chemicals and minerals. Okay? And I think that could be done at a very, very low cost, because this manufacturer that made the vitamins, they were selling their vitamins for $1 a piece. Okay? But if I were to buy 100,000 of their tablets, I could buy them for a penny and a half. That's what their costs were. Okay? So you can see that they're making tremendous amounts of profits. My guess is that this company that was selling the organic vitamins, and they're advertising that, they brought in the vegetables from their own organic farms and they processed them to create the high value vitamins. My guess is that was a bunch of malarkey. My guess is they were buying chemicals just like every other manufacturer of vitamins was doing, and they were basically mixing them up and selling them. Now, I also learned that some vitamins are worthless, and I'm not going to get into it. You have to do your own research. And the vitamins that really have everything you need, I think, are going to cost a little bit more, maybe a couple pennies rather than half a penny. But it just seems strange to me that nobody had ever told me that. We figured that out in our class, so that you could develop tablets that provided 100% of your nutritional needs. They're probably going to be different for kids under 5, for adolescents up to 12 or 13, for teenagers are going to have different chemical needs. Young adults, pregnant women have different adults, and people over 50 probably have different nutritional needs. And that's when it started to dawn on us, me particularly, that what we're seeing are chemical needs that aren't being fulfilled in autism. Why have we all of a sudden, we have schools in Iowa here that 1 out of 6 kids have been diagnosed with autism. That's crazy. It's a chemical deal. Somehow their brain is not getting the chemicals that they need. I don't realize this, but you have special glands in your brain that produce over 100 different chemicals, amino acids and proteins and things. So you need chemicals to produce these secondary chemicals in your brain, and your brain functions. Remember I said that I thought these specialists out there were biochemists? That's what happens in your brain. I mean, most of your emotions, fear and fright and love and hate and all of these emotions are created inside your head with different chemicals happening. I don't know if you realize that. You're going to sleep at night. There's a medulla back here in the back that's attached to an adrenal gland. The adrenal gland produces the serotonin, and the serotonin then gets you to relax, gets you into sleep. And then another chemical comes in that puts you into a deep sleep. And you're in deep sleep for 90 minutes or so, and then the serotonin comes back and kind of starts waking you up, and another set of chemicals, all out of those same glands, part of your brain, starts waking you up. All of a sudden, it appears that we have all kinds of diseases that the medical profession is charging you money for that are really grounded in lack of certain chemicals. And that all goes back to how your digestive system works. There's something in there called gut flora, 10 million, 20 million, trillion gut flora, which are really bacteria that digest the food, which means, it's like an angleworm or a night crawler. It takes this slurry that's coming out of your stomach, and it goes in one end and comes out the other end. It has potassium, zinc, phosphorus. That's how we get our chemicals, from that gut flora. And then it goes through a membrane into your blood supply, and it goes around and it goes through the membrane in a cell to provide life to every cell. Okay, so if you're not getting a certain chemical, you're not going to function right. And people that are, not getting enough water, they start fainting. They can have delusions. They can have headaches. Okay, so a lot of the labels that we're now putting on what we call diseases or conditions are really related to the kind of lack of chemicals in your brain or in your body or in your cell. And that's a whole different approach to medicine than trying to look at a symptom and then find a chemical that'll trick it to, not being aware of it anymore. That's not curing anything. In fact, I don't think many of the pharmaceutical chemicals actually cure anything. I mean, you hear them talking about we're curing cancer and all that kind of stuff, but I don't think most of the chemicals do that. I think the chemicals that I'm talking about are, raw chemicals. Find them right on the chart, the chemical chart. Okay, so the people that designed this millions of years ago or whatever, they knew what chemicals were needed for every part of the body. And they were hoping that we would have food stock on this planet that, when it goes through our digestive system, would break it down into those chemicals. And if that doesn't happen, if you're not getting the raw foods to produce those raw chemicals, you're in trouble. Okay, and I think that's part of aging. I think that's what Alzheimer's is. Older people have different levels of acids in their stomach, and it affects how those foods are being broken down. So you could be eating all the best food, but it's not getting into your system because it's, and this is interesting, a lot of people have low acid, and it could be related to all these over-the-counter antacids and things that people take because they think they have too much acid in their stomach. So, I really think that the person today who's the healthiest is not taking any artificial drugs, but they appreciate and understand the chemicals that they need. And I think in the future we're going to have tablets that can provide that. We're going to have roughage that can provide the kind of roughage that your body needs to keep functioning. And I think we have to be very protective of having quality water. Even the water we get in these plastic bottles, if they sat out in the sun, can be dangerous. So I think we need more awareness, we need more education, we need more training of people to take care of that body that probably was designed to take care of itself. Now, you're going to have things happen. A friend of mine who was only 34 years old was working one of these zip lines, and one day a strand on the zip line broke, and it came back and caught him in the leg and cut it deeply. And he was in the workshop, and he grabbed a rag and he wrapped around trying to get the blood to stop. What he didn't realize was that rag had been used to clean some other metal parts, and it had a concentration of benzene in it. And what he didn't realize was that benzene got into his blood, and it created a leukemia type response within days. And he went from not having any leukemia to being stage 4 leukemia in just a matter of days. And then it formed into encephalitis in his brain. His brain swelled up, and within a week, he was dead. He was a person that was, you know, healthy, and within a week, he was dead. I've also had students that have told me, you know, on their deathbed, and this is kind of hard to deal with sometimes. One student particularly was a, you know, easygoing kind of nice guy in my class. He went to phys ed, played basketball, and then became an assistant basketball coach for a school there in Kansas. He was only like 23 years old. He had gotten strep throat, and he should have stayed home, but he had his final game of basketball. So he went, he coached it, he was sweating profusely, his fever was getting higher, and he won. And so all of his friends took him out partying. They were drinking wine, and then they got to more hard liquor, and then after midnight he told me they started smoking pot. And he woke up the next day with lymph glands under his arms as big as baseball, and other glands farther down were as big as softballs. And so his friends got him to the hospital, and they said that there wasn't anything they could do for him. He was in a stage 4 lymph cancer situation. And he told me he believes that he got that in one night. It was a combination of things that he did that basically he killed himself. And you know, he wasn't saying that it was the pot or the alcohol or the strep throat, but that combination of things was what it took to basically kill him. And he only lasted a couple months after that. So I think we need to be more knowledgeable. We can't take for granted that the medical people are going to have the best answer for you. They're going to have the best answer for themselves. And so you have to be knowledgeable, and I think you should have the right to second opinions. I would urge you to look into you know, people that are looking at natural medicine and you know, some of these other different approaches. And we know that in Europe they have entirely different strategies. I think Belgium has a machine that can zap a cancer cell, and within a week it's gone. And there's no surgery, no chemicals. And why are we using those kind of strategies? It's because, you know, the people are making the money they are the way it's being done today. So I think the consumer, the patient, you have to have an advocate, you know, and we need these people that are trained to look at options and deal with the medical industry, deal with the insurance company. So I would say in the future you're going to have not artificial food, but I think we're going to have manufactured food if we're going to feed everybody. If we have 10 billion people, we don't want half of them starving. I think we can do that in manufacturing ways at very low cost so that everybody has not free food but very inexpensive food. I think we need to know exactly what each of our bodies needs, and I think everybody's body is a little different. But we have to have pure water, you have to have exercise, you have to have sleep, you have to avoid stress. You know, there's a formula here that if you live by it, you're not going to need prescription medicine. You're not going to need to go to the doctor. Okay? That is what real health is. Okay? So I know that's controversial and probably runs counter grain to what you've been thinking about in the past. But I think we can provide those services not just in the United States, around the world, in health clinics that have this as their base. You know, they can help you with wellness and prevention, and they can help you stay healthy and help you stay healthy. Okay? So I see a major change in the direction that we need to take healthcare. I don't think Obamacare is going to last very long. I think the expenses are going to far outweigh the benefits. We already have some major insurers, providers backing out of it. You know, so it was put together for the wrong reason, and I think we need to look at other options. And I think you need to look at different options as well. Okay? Thank you.